Hi everybody, it's been a couple of weeks, actually about 3 weeks since my last video. I just wanted to give you an update on my Achilles rupture progress. So just to recap, I chose the non-operative approach, so I chose not to have surgery. I tore my Achilles tendon playing basketball now I'm at 4 weeks, so a month ago. So again, like I said, I chose not to operate. So now I'm at 4 weeks and I just wanted to give you an update. So what's changed? Well, first thing is I started physio literally a week and a few days in after my injury. As you recall, that is a very important part of the healing, which means that you have to start physio right away. It doesn't mean that it's aggressive physio, it just means that you have to start. So the first physiotherapy session was very light physio. He did a lymphatic massage and really just helped with my knee stiffness because, I was in crutches for that first week, and a result of that is that my knee is bent, and so it was just hard to even straighten out my leg. So that's what he worked on. Sorry, I'm just going to turn off my phone. Sorry about that. So that's what he worked on, and it felt really good. Also, what I was doing at home was just moving my toes as much as I could. Moving my toes. Every time I had a chance to, I would move my toes. And he also massaged the bottom of my foot, which felt great because it had become really hard. And he said something that stuck with me. He said that the body is really good at getting rid of something it doesn't use. So, I saw the effect right away with my foot, with my knees, and now, especially now, I see it with my calf. I mean, the atrophy is crazy. So that was the first week of physio. Week 2, he started doing some electrotherapy, which is just kind of electrostimulation to the muscle. So he did it to help me kind of go, just to stimulate the dorsal movement of my foot, like the dorsiflex. Not a lot of dorsiflex, but just a little bit. And also, what was it? It was my quads, exactly. So he did some up here as well. And again, some massaging and just getting rid of the tightness, because some muscles in my foot were starting to get really, really tight. I guess they're overcompensating. So that was week 2 of physio, and I have to say, week 2 I felt much better because a big change was I got the iWalk, which I don't know if you don't know what the iWalk is, it's a lifesaver because it allows you to get around the house without crutches. So it liberates your arms, which is really great because I'm home alone. And so, just carrying things, making myself, just getting myself a glass of water was a challenge with crutches. So now I'm more mobile. So also my physiotherapist said it's really great because it makes me work my hip. So, this is the first place as well that gets really weak when you stop using it and when you're on crutches. So he loved the iWalk for the fact that it helps me work my hip, and also it keeps my foot elevated. I don't stay in it all day because after a while my knee starts to get fatigued, but if I have to make some lunch, if I have to get around, do some laundry, whatever, I use it and it's fantastic. And I use it when I have to get out to some appointments. So week 2 was a really big change with the iWalk and also with the physio. I also noticed that my foot was starting to feel much better week 2. Again, I was doing a lot of the toe movements. I was doing the exercises he gave me, which were just working on strengthening the knee, like working on the range of motion for the knee, and the hip exercises, and of course moving a lot of my toes. So week 3, which was last week, he really introduced the eversion and inversion exercises with my foot, which have gotten really, really good. I'll give you a little demonstration because I'm actually proud to show you. It's a slow progress. This process is an exercise in patience, but it's really worth it to take your time and not to rush things. So, this is, it may not seem like much, but for week 4, look, I can move my toes. I can go around. This is, for me, really amazing, So, but I've been really sticking to it. I've been doing my exercises every day. Look at that. The signal from my brain to my foot to move into Dorsey is a challenge, but it's gotten very, very good. It's gotten stronger. So I'm working on that every day, and aside with and with the other exercises that he's given me to do. So that's where I'm at week 4. I'm still in the boot, as you can see. I have to keep it on most of the time. I take it off when I have to shower and when I'm doing specific exercises where I want to be out of it, but I have to stay in the boot. I think the last time I did a video, my boot was at 30 degrees. So after 2 weeks, they put it to 15, which was a pretty big jump according to my physiotherapist, but I adapted to it. The first couple of days was a challenge because my Achilles tendon felt very, very tight, and it felt like I was really pushing it, and I would find my foot actually elevated in the boot because it was trying to like stay at 30 degrees because it was just so tight. But when I would find myself doing that, I would just kind of, you know, like try to position my foot into the boot back at 15. And after a few days, it got comfortable. So I've been at 15 for almost 2 weeks, 15 degrees. And next week, which will put me at almost 5 weeks, they're going to adjust it to 0. Like, so my foot and my leg are going to be at 90 degrees. So I'm going to be flat on the ground. I'm able to put my foot flat on the ground, which is great. I don't, because before when I was showering, I have a bench in the shower, so I usually would like cross my leg like this, and so that it keeps my foot in a kind of planter's position. But now I'm able to really just sit like this with both feet on the ground, still in front of me, so it's still, you know, doesn't put pressure in the back where my tendon is healing, but I'm comfortable that way. So that shows to me that I'm making progress. And a question I asked my physiotherapist, I said, how do I know if the tendon is not healing loose? Because for me, that is the fear, is that, you know, now that the tendon is kind of like binded together and it's healing, I'm worried that it's like, it's loose, that it healed like this instead of like this. And he said, don't worry about that. He said, the fact that your range of motion is so good and that you have that tightness, it means that it doesn't look like it's healed loose, because otherwise you wouldn't have that tightness and it wouldn't be such a challenge, you know, when we're trying to do some Dorsey exercises. So I really trust him. He's a great physiotherapist. He's really encouraging me not to be too, not to rush to try to put weight or stuff on my foot, which I appreciate because I'm the type of person who really like wants to push. So he's saying, you know, like if you're staying for another 2 weeks in the boot, it's not going to make a difference in a year. Like think of the big picture, because the last thing you want is to have an incident where you have another tear and then you're right back at square one, and that is the last thing I want. So what else have I been doing? I've been taking a lot of multivitamins that promote healing, you know, like vitamin A, vitamin C, zinc. So that I've been taking religiously every day. I drink turmeric tea every single day, and I really, really believe that it has helped with inflammation, because I have very little swelling. Ever since I had the injury, I had very little swelling. And drinking curcuma, which is turmeric tea, is something I do every day anyway, but I really think it has helped with the lack of swelling that I have in my foot. I do notice that I have swelling if I have a big day, like if I have an appointment and I have to be out and about, or returning slowly back to work. I notice when I get home that I do have some swelling. But aside from that, I'm amazed at the lack of swelling that I've had throughout this injury. So I do recommend that. You can look it up. It's turmeric, ginger, lemon, but I drink it every day. Honey, yeah, which helps with the taste. So that's where I'm at. I'm excited for next week for the next adjustment, which is going to put me at 0, which is great. And yeah, I've been doing physio about 2 times a week, you know, and that is really important to the protocol, because I need to be aggressive with the physio since I chose a non-operative approach. And I'm actually very, very happy that I chose not to do surgery, because, you know, I'm not dealing with a scar. I'm not dealing with the risk of infection. It's going really, really well. It seems to be healing well. So, you know, for those of you who are trying to decide what to do, I mean, I can't tell you if this is the right or wrong thing. Right now it feels like the right thing. As I explained in my previous video, I'm not the type of person who takes surgery or invasive procedures lightly. So I'm really happy that I chose not to go with surgery. So if you're making that decision, just really do your research and just know that if you're disciplined and patient, most of all, it is going to heal. My physiotherapist, actually the clinic where I go, they're actually treating me, which is like, I think it might be like one of their first non-surgical cases. And they're treating another girl who's a basketball player who has a rupture as well, and she chose to do surgery. So it's really interesting for them because they have two live, case studies right now, and they're able to see. And our injuries happen virtually at the same time, so they're really able to look at our progress and really analyze both approaches. So I'm happy that I'm able to help people with this who are going through this decision. So I'll try to update in another couple of weeks. Hopefully I'll be well into some weight bearing by then, because in about 2 weeks, when I get to 6 weeks, he said that we're going to start getting a little bit more aggressive with the physio and start some weight bearing, and I don't think walking yet, maybe some light walking, I'm not sure. But that's where I'm at. So yeah, anyway, good luck if you're going through this, and I'll see you in a couple of weeks.